Money is the things that you can do with money, the opportunities that you open up with money. I gave you the figure, overall figure for the WHO. WHO is less than $1 billion a year. New York police is more than $3 billion a year. And WHO is supposed to be in charge of health around the world for 6 billion people. Now look at the order of magnitude of how we give funding for one as opposed to funding for the other. Now, the reason why we don't put proper funding in is not because we are miserly. It's not that. We are good people, basically. People are fundamentally decent. It is because they see health as a consumption item and not as an investment item. Smart people have not yet understood that good health means good productivity, means good jobs, means good economy, means good social equity in the world. That is the problem, that people have not created the link between health and productivity. And you see that even in the highly focused debate in the United States. All that people are talking about is, many people don't have insurance. But they don't realize that it's not just a question of Medicare and Medicaid. It's a question of a healthy population among the poor will make the poor more productive members of society. And therefore, overall GNP will increase by putting more money into health. But people see it as consumption. They see it's a type of a drain. And they say, oh, so many $1 billion are going and so many billion even in future will go down the drain. And so we just don't give proper importance to health. You notice another example. Every day the newspapers will tell you how many US soldiers have died in Iraq. The figure comes out every day. Notice that the figure of the US wounded in hospitals in the United States is relatively no news. How many of you can give me the exact figure of how many are wounded in hospitals? How many of them are seriously wounded, less seriously wounded? How many of them have suffered trauma mentally to the extent that they can no longer be productive members of society? How much on these the wounded, the veterans coming back and who can no longer fight? And so we put a lot of money into those who fight. We train them well, we send them out, and we watch whether they die or do not die. But once they come back minus a leg or minus peace of mind, we literally forget them. And this was the Walter Reed case, which came out a couple of years ago. And now we are talking of a developed country. Multiply this by 100 in other countries in the world, some of which give no importance at all to people who are sick or undernourished or underdeveloped. And so we need money, and I'm afraid we do not have enough money. Now, the second question was the brain drain. Brain drain is also connected with poverty, because poverty really means absence of job creation. If you are a rich country, you can create jobs. If you are a poor country, you cannot create jobs. If there are no jobs, nobody is going to sit at home and accept to starve to death. It's not a part of human nature, is the desire to go out and survive. And so what is called the brain drain is really the push for survival, that people are not willing to sit at home and die. They want to go out and they want to work and they want to earn salaries and they want to send money back to their families. And so what is called the brain drain is really job creation abroad and remittances back into the country. Remittances are now most important form of income for the developing countries. So you are sending out a brain drain, but you are getting back money. Money which should have come by other sources, but which is only coming back as a result of the brain drain. But your question also was, How can we improve it? Well, some of it is being done by non-governmental organizations like Doctors Without Borders, which is doing a lot of work in developing countries. So you do have civil society producing its input into this problem of the absence of doctors. I've already referred to how philanthropy is filling some of the gap. Doctors Without Borders is filling part of the gap, but we are far from where we should be in a globalized world in which our destinies are interlinked and where my health is as much your problem as your health is my problem. Over to Montclair for 2 questions from Montclair.
2 questions? I know that many of the diseases that plague developing countries like malaria and dysentery and diarrhea already have cures, and there's really no need for new cures to be developed. So why is distribution such a problem, if that is the problem, and what can the UN do to, what incentives can be given to drug companies to sell their drugs at lower prices in developing countries?
Okay, second question. Distribution was the second question.
The second question would be just the question of distribution on the ground. What are some of the obstacles that we're facing on the ground when it comes to distributing these drugs in poor areas?
Okay. On the first question, your assumption is not correct. Your assumption is that the drugs exist. That is just not true. We have drugs which help in malaria, but if they were cures, we would have got rid of malaria. But you cannot get rid of malaria. You cannot, because malaria is not just a question of how to get rid of malaria after you've got it. That is a distribution problem. It's also a preventive problem. How does malaria start in the first place? It starts because of raw sewage, because of water that is not piped. In other words, the poverty aspects of water. And so you have to address those stagnant water and sewage sources which are breeding the mosquitoes, which are then creating the malaria. The second question is, we do a lot of research on genetics. Surely we can do some genetic research on mosquitoes so as to destroy the gene of the mosquito-carrying female mosquito. Remember that just as AIDS is a femininized disease, malaria is spread feminized manner. It's only the female mosquito which is creating the problems. Can we do something to get rid of the genetic makeup of the female mosquito? And surely this is it's a scientific problem that we can address. If we can walk people on the moon, surely we can do something with the genetics of the female mosquito. So part problem is poverty, part problem is the genetics, and part problem now is your third problem, which is of distribution. Distribution cannot be done in poor countries. You may have the drug, but it is sitting in the wrong place. You don't have enough pills. How do you spread it all over the country? You are a poor country. You don't have resources. You don't have hospitals. You don't have clinics. You don't have doctors. You don't even have nurses. How are you going to distribute if there is no money? Now, how do you increase the money? This is not a question of foreign aid. This is a question of greater priority to health within nations also. We know it for a fact that developing countries are putting much more money, for example, into maintaining their army than it is putting into maintaining their health. And by a factor of as much as 50 to 1, 50 times more money is being spent on armies and defense than on health problems. And so you need, and this is what is called good governance. In other words, building up the percentage of wealth that is spent on the social sector, on health and education. This, I'm afraid, is something that we have to keep pushing and keep pushing more and more again to force countries to come to terms with the fact that national policy must give greater importance to health than it does